Hello and welcome. Can we see me? Can we hear me? Hello, everyone. Welcome to today's webinar. Let me see in the comment section. If you are here in the comment section, let me see you. We are live. All right. We just start 1 second. We'll start right up. It's a bit too much light. What will I see? Let me try this. Okay. Well, welcome everyone. Let me know where you're joining us from today for this class. So I'll put up my slides, then we start. Okay. Okay, well, welcome once again. Let me know where you're joining us from. Good morning, evening, afternoon, whatever part of the world you're joining us. Right here, it's morning here. So we're welcome to this masterclass. It's a masterclass organized by in an initiative that is being launched by the Autism Renewed as an organization. So I'll get more into what it is about as we proceed today. Okay, so as we proceed today, we'll get more information about what this initiative is about. So let me put up my slides. All right, so okay. Just having a bit of hitch here. The slide. Okay, yes. Okay. I believe you can see my screen right now. Alrighty, can you see my screen? So welcome once again. So the title of this masterclass is "Please Don't Change My Hand." So the can we see my screen? Can I get your feedback in the comment section? If you can see my screen, I'm sharing my screen. Okay, let me. Okay, let me know if you can see my screen now. Um, let me know if you can see my screen now. So the International Day for the left-handed International Day of Left-handed people is the 13th of August. So um every year. So this year, Autism Renewed is launching an initiative, and the title of the name of the initiative is called My Left Hand Champion. So that's what informed this masterclass. So let me share a little bit about my left hand champion. So this is my left hand champion initiative that is launched as by Autism Renewed. So Autism Renewed is an organization that focuses on supporting children and children who have speech delay, autism, and other neurodevelopmental differences. And we have several programs and initiatives, courses and resources. We support these children, support their families, their parents, educators, pretty much everyone, every stakeholder working with these children in order to help them to navigate developmental challenges and thrive. So we have several things we do. So this is an initiative focusing on left-handed people. And this was born out of the fact that in my work at Autism Renewed, working, one of the things that I help parents and families and children with are learning challenges. So from time to time, I have courses and resources on learning difficulties and different things that can make it hard for a child to learn. And one of the things I found in my experience is what we call learning differences. So, and sometimes people may confuse a learning difference with a learning disability based on the presentation now. But when you now go to a professional and they begin to assess these children, then they realize that it's actually a learning difference. So handedness, some children have had their have had forced change of handedness. So meaning that they were left-handed or they had left hand preference and they were forced to change their right hand. And because of the architecture of what being of the let's say the design, the unique design of being a left-handed person compared to a right-handed person, sometimes some of these children begin to have learning difficulties because it's like you've caused a confusion in their brain architecture and their ability to learn sometimes. Also because of the trauma associated with the process of forcing change of handedness, which we'll get to in the webinar. So that's where this initiative came from. So our focus with this initiative as an outflow from Autism Renewed is to spread awareness, and that's help to recognize what handedness is and why it matters. Most people don't know why. So that's why they are seeing handedness as an abnormality or something that needs to be changed. They don't understand the implication. Advocacy as well to challenge the myths, because there's a lot of myths, even some cultural myths or mindset regarding this. Also, education for people, for families, parents, educators, professionals, all stakeholders, and even the children themselves. Enough education, enough knowledge for them to understand what it is about and to provide the correct support. Because I say something all the time that if you don't diagnose correctly, you can treat correctly. So I'm not saying that this is an ailment. I'm just saying that any situation, that means if you don't identify what is really going on or you don't understand something, you're bound to make mistakes or make assumptions. And empowerment is very important. Empowering the parents and families, empowering professionals as well who encounter the children, but also much more empowering the children to know themselves and be able to advocate for themselves and speak for themselves. Even if they can't advocate for themselves, when they are empowered, they're able to escalate to a trusted adult if they're experiencing any form of stigma, any form of labeling, and any form of forced handedness. So that's what informed this year's theme. Please don't change my hand. And this is speaking from the children's voice. And here is the goal of this webinar today is to help us understand and be able to support the left-handed child. Okay, so once again, you are welcome. A little bit about me. I mentioned that I'm Dr. Lolake, I'm a medical doctor and I'm a certified behavior analyst. I'm also a global autism expert working with families of children with speech delay, autism, and other developmental challenges. Okay, using different strategies, resources, tools. I also work with educators and schools, how to create right learning environment for children, create IEP programs as well. And I also work with medical professionals to train them on developmental challenges and how they can support families and parents. I believe in putting the power in the hand of the parents because a well-informed and equipped parent becomes a parenting advantage that will help the child to navigate and triumph. Of course, I said I work with educators and professionals as well. I believe that one of my major things is to bridge the gap between the families and the professionals, meaning educators, therapists, medical professionals that work with children, because that's where real transformation takes place. I've talked about the initiative just to introduce it. Okay. I've mentioned again that this word, please don't change my hand. It belongs to the child. Okay. For generations, naturally left-handed children were corrected before they were even old enough to understand what was happening. Some were told, use your correct hand, not that hand. Switch your pencil. The left hand is wrong. So most times there's a lot of confusion that is created along this line. Some of them complied, others simply learned that something natural about them was considered unacceptable. Today we offer a different message. Your natural hand preference is something to understand, not something to shame. So, welcome once again to my left hand champion. I've talked about the initiative and what the initiative is about to also promote understanding of natural handedness, especially in communities where we see have a lot of cultural beliefs, a lot of myths, and first hand switching still influences how children are raised and taught and how they are labeled. So that's what. So today, by the end of today's masterclass, you will understand what handedness is and how hand preference develops in children, why it's not a habit. Because sometimes the way we correct, the way some people try to correct it, like that the child is doing something that is wrong. So it's not a habit to be corrected. It's not a behavioral problem, or it's not a choice to be corrected. Okay, we're going to talk about some common myths and the truths and how to help. We're not only going to highlight the challenges, but practical ways that parents, educators, health professionals can protect and support natural hand preference and also support children and families. Most importantly, you should live knowing what to stop, what to start, and what to do differently. So I want to know who I have in the room today. Put in the comment section. If you are left-handed, let me know who you are. You are left-handed, you have a left-handed child, or a left-handed, or you're a caregiver to a left-handed child, or you have a relative, maybe your niece, your nephew, your brother, your sister who is left-handed, or who was left-handed and experienced first-handedness, or you're an educator or you work with left-handed children. So, for example, you can be an educator or a teacher, you can be a children church teacher or leader, or or children church pastor. One way or the other, you work with children, or you teach children who are left-handed, or you have taught children who are left-handed at any point or the other, or you're a health professional or a developmental professional, or you simply just want to understand what handedness is truly about. Or were you or someone you know ever pressured to change their hands? I mean, to be amazing for you to share those stories in the chat and much more through our contacts. Share with us. We'll share all our contacts, our email addresses, websites, social media. I think I'll share more at the end where you can share those stories, because we really want to hear those stories so that people know that, their real life stories, their real life struggles, and sometimes some of the difficulties some people have experienced, even though they are now adults and you think that some of those things have gone. The truth is that what happens in childhood doesn't stay in childhood. So even if you succeeded in forcing the child to begin to use their right hand, are there hidden struggles that we are not aware of? We'd love to hear your stories or story of someone that you know or you've seen. So 1 in 10 people worldwide are left-handed. Left-handedness occurs across countries, across cultures, across ethnicities, languages, social economic groups, and generations. Reported prevalence has varied partly because of social attitudes towards left-handedness have varied considerably. Left-handed people were always part of our communities. The question is whether they were always allowed to remain visibly left-handed. And that's why in certain cultures and environments, we seem to see maybe fewer left-handed people. Could it be that it's not that we really have fewer left-handed people, but perhaps quite a number of them um they experience forced change of their handedness. These are things to really think about. Where did some of the left-handers go? Historically, left-handed children were encouraged or forced to use their right hand through either verbal correction or shame or labeling, moving objects from the left hand into the right hand, school rules and punishments. Because I've had clients who the child experienced first the handedness was changed in school. The educator was the one that was that forced the change, and the parents were not aware. By the time parents became aware, the child was already having some unpleasant impact from that. Some cultural or religious beliefs, some were changed through fear of social judgment. Because sometimes if there's no empowerment of the educator, of the parent, or of the child themselves, a child may get into a classroom and he or she sees all the other classmates using their right hand. So a child that has not been empowered may be thinking, really, maybe something is wrong with me. Let me try to be like every other person. Why am I different? So that's why I mentioned earlier about different. It's a law of difference, not deficiency, not being deficient. So you must empower your children, or a child needs to be empowered, needs to know themselves, and you explain to them. So it becomes empowerment, such that if someone is trying to shame them or someone is pointing out your difference, you know that your difference is your uniqueness and it doesn't make you less. It's just a law of difference by design. So sometimes the difference wasn't in the children, it was in what the adults around them, namely the parents, the educators, caregivers, all stakeholders, everywhere a child is and he's in the care of an adult, whether it's in a religious center, Sunday school, children church, extracurricular, extramural centers, or wherever, the adults around them, what they permitted, because the truth is that it's the responsibility of the adult, because at every point in time in a child's life, they are in the care of an adult, even when they are not, even when their parents are not there. So in school, in church, in different places, a child is always in the care of an adult. So if you're an adult at any point in time that a child has been in your care, you have a responsibility to that child to ensure that you have the right knowledge and information and empowerment to support that child. Because sometimes if the adults around them are not informed and someone else is doing that, then it becomes very easy for them to for the child to experience some of these things. It's not just an African story. So first-hand switching has existed historically across many parts of the world, including Europe, North America. I know someone who is Caucasian who has experienced first-handedness, as a child. So I know that it's not just an African thing. No, it's not just an African thing. Um, this conversation is not about blaming cultures, and that's the truth. Like I said, we're not just here to highlight all the negative things. It's not about blaming cultures. It's about asking, what do we understand about child development today that previous generations may not have understood? When we know better, how can we support children better? So the truth is that if the previous generations didn't know, we have a responsibility to know. This information is out here, these resources are out here, and we need to do better. But when we know better, we do better. Some African communities and diaspora communities, in those places, this conversation remains particularly urgent because beliefs about left hand may still influence children today. What exactly is handedness? So handedness is the person's tendency to prefer one hand for skill activities. Writing is only one of the examples. That is the that was one of the commonest one that is highlighted. Or most times, some people may not even notice until the child gets to the point where they are writing. So some children, from when they are quite young, even before they reach the age of trying to write, you can already see their preference for one hand or the other. But most times it becomes more apparent when they start writing, and that is school age. But most of the time, if you observe closely, there are other activities that you can observe to know a child's hand preference. Things like eating, drawing, throwing things, cutting things, brushing their teeth, manipulating objects. So handedness is a pattern, not simply one pencil choice. So it's not only the way when the child is writing or holding a pencil. And that's why sometimes if you meet, I've met some adults who experienced this first-handedness. And one of the things I normally notice is most of them they use their right hand in writing or drawing, but they use their left hand for every other thing. They use their left hand for every other thing, but they use their right hand for writing. And that's why it shows you that most times they were already doing a lot of activities with their left hand. And like what I'm saying, it's when the child starts writing, it becomes what do you call it? The thing becomes more apparent when the child starts writing. So that's when the first-handedness usually will take place when the child starts writing. But the child has been doing so many other things with their left hand, and it is because you will notice that the change or the force is always when the child holds the pencil. So they remove the pencil, put it in the child's right hand, remove the pencil, put it in the child's right hand. But other activities most times is missed. So that's why you often see it that way. Preference is not the same as skill. So the dominant hand, the more skilled doing hand for writing, for drawing. The supporting hand assists, stabilizes, like keeping the paper in place. Like you want to do something and keeping the paper in place, stabilizing. So a child may prefer one hand, but still need to develop strength, coordination, and fine motor in that hand. So children use both hands in everyday life. During writing, one hand writes, the other stabilizes the paper. Supporting handedness does not mean stopping a child from using both hands. So even people that are right-handed, you still use your left hand to do something. You're cooking, you can use your left hand to hold the pan or the handle of the pan, and using your right hand to stir. So the conversation is not stopping one hand entirely, but understanding the dominant hand, which is the more skilled hand, then knowing that the other hand is the supporting hand. So both hands actually matter. The hand, however, is a downstream of the brain design. Remember, I mentioned is the concept of difference in design. It's not whether one aspect is less compared to the other. It's a difference in design. And I think that information is very important. Handedness is connected to how the nervous system develops and organizes movement. The hand we observe is only the visible part of a much larger developmental process. So it's not a habit, it's not stubbornness, it's not disobedience, it is not copied from friend. Handedness is part of human neural development. So neural has to do with the brain and nervous system development. Handedness begins earlier than most people actually realize. Research into fetal development has observed lateralized hand and arm behaviors before birth. This supports an important principle that the foundations of handedness begin long before a child learns to write. So remember, I mentioned again, most people begin to notice when a child is writing, but most times, because the hand, remember, there are different activities that can be used for, it begins way before then. So when a child repeatedly prefers the left hand, we should not automatically interpret that behavior as she hasn't been taught properly or she needs to be corrected. Handedness is not simply a habit adults create. Hand preference often develops over time. So at infancy, both hands are used freely. When a child becomes a toddler, early preferences may appear. So when children are young, the truth is that um, the early stages, which I'll talk about later on, the child can be using both hands, but they get to a particular age, around 4.5, where the dominant hand becomes more apparent. So for some children, from way in their first year, you may already, if you already know how to look out for it, but not many people are trained or really informed about it. So most times people, you won't notice it. Most children will often use both hands, but in some cases, you can already see this strong hand preference even when the child is under one. Meaning that when the child wants to, remember I talked about activities. So what are the activities for a 1-year-old or a little child? Is to play with their toys, their rat, maybe shake their rat to pull something, tears a paper, or engage in the environment, interact with the environment, or interact with people. So if you're very observant, sometimes, not all the time, you can already see a very strong preference for a particular hand. Even when they want to start eating and they're holding a cutlery, how do you know? Without handing over the cutlery or the toy to the child, just put it on the table and watch what hand does the child most times prefer to pick that object with. Pick their rattle, or pick a Lego, or pick a ball, throw a ball or something. What hand? In some cases, you may already see the preference for the left hand, because remember I mentioned about what hand is the dominant hand, the well-skilled hand, because it's a concept of design, you see. So the body, the same way a child will naturally be able to sit, neck control, all that developmental milestones they are attaining. Developmental milestone of beginning to use your hand to throw things, engage your environment, it's a milestone. The same thing as getting to read and write is a milestone. But because sometimes we may not know, so we may not notice it, all right? But when you have knowledge, you may notice it. But however, even if you have a child using both hands in early years, they begin to what we call lateralize, or the dominant hand becomes more obvious when they get around 4 years old, 4 years, 4.5, then you begin to see that hand become more prominent. And of course, we know that's the age where children begin, when they are scribbling things, when they are sitting down to really engage in more intentional things. By that time, things like feeding will be established. Remember, we're saying all things being equal. Of course, I'm a neurodevelopmental expert, so I know that children have different developmental ages. All right. So this is just like a general base, of course. So when I'm saying that at this age, child is scribbling, so that you don't have someone here who maybe your child's chronological age, which is the age at birth, is different from their developmental age, and that can be due to different reasons. Some children have neurodevelopmental delay or differences. Some children have maybe the child was a prematurity, and you know how the age is calculated. So bearing all that in mind, but I'm just teaching as a baseline. Just same way we teach, okay, a child who sits at 5 months. You have some children who are sitting at 8 months due to different reasons, all right? But you get the concept. The concept is that early years, children will use both hands, but as they grow older, the dominant hand becomes more apparent. So the thing is that don't try to influence it by every time you want to give the child something, you're trying to force right hand, all right? Of course, like I said again, the hand preference will develop over time from infancy all the way to early school years. So, like I said, in preschool, it becomes more noticeable. So toddler years, the preferences may appear, but it's very more apparent in preschool and in early school years. Clear, consistent preference for tasks becomes very apparent. So development is progressive and individual variation exists, which is what I was saying. A young child switching hands does not automatically mean something is wrong. I mean, when they are young, it may simply reflect a preference that is still emerging. All right. So observe before you interfere. So don't try to, like I mentioned, don't try to put a pencil in the right hand, or their spoon or cutlery are trying to don't trying to put it in the left hand or something. Most times it's even better that you put those things down and get the child to pick those things. So don't switch objects. For example, the child puts something in their left hand. Don't take it from them and put it in the right hand. Don't decide which hand the child should use. Don't try to influence the design. God had designed the child with a natural preference. So it's not what you're trying to do. Because remember, I mentioned that the handedness is a downstream. A downstream means that the upstream is where the foundation is, which is in the brain. And that's God's design, not you. So you cannot, since you didn't influence that, stop trying to influence the downstream, because you changing the downstream does not mean you're changing the upstream. And the upstream, which is foundation of the brain, is what is most important, because that's what determines how they can begin to engage in their world and develop appropriately. So don't think that because I keep putting it in the right hand, take it and put it in the right hand. No, you can't decide, because any decision you're trying to make is you're trying to force it. God has already designed the child. So create the right environment and the right process of engagement to allow the child's natural hand preference to develop. So what you should do is place objects centrally when appropriate, allow the child to reach for those things naturally. Even when they are babies, once they can begin to stretch their hands to, even when they can't sit yet, and you are doing maybe what do you call it, like this tummy time, or your play time, when you put them on the mat and they're lying down, and you put a lot of, there's this what we call the play gym that has all the, dangling rattles and toys, and the babies are trying to reach for it. That alone is good enough for a baby or less than 1 year, because then don't influence it. You will see naturally they are growing, and the body will begin to show the preference that God has already designed. All right. So allow the child to reach for things naturally. Observe patterns across different activities. All right. From when they are throwing a ball, when they are shaking a rattle, when they're trying to scribble, when they're trying to tear things or reach for things, reach for a bottle, reach for a toy. So give both hands opportunities to develop by not trying to influence. Then seek professional advice if genuine motor concerns arise. So motor has to do with, the muscle. So you notice any concerns or any abnormality, or you're not sure. The goal is neither right-handedness nor left-handedness. The goal is natural development, and that's to allow the natural design that God has put there to develop naturally. So some myth and facts. Some people believe that left-handedness is a bad habit. Some believe that a child using left is being stubborn. Some believe that children become left-handed because nobody corrected them, or nobody intentionally started putting objects in their right hand. The truth is this: left-handedness is a natural occurring variation in human handedness. I explained that concept of design, not deficiency. And it's not less, it's a concept of difference. Natural hand preference should not be interpreted as deliberate disobedience or being stubborn or defiance. Adults don't need to train naturally left-handed children out of their preference. Okay, so it's not something you train out. Some people also believe that change the handedness early enough and the child will become naturally right-handed. Some say a young child sometimes changing hands means something is wrong. That means a child less than 4. Some say being left-handed means something is wrong with the child's brain. The truth is that nothing is wrong with the child's brain. You don't requiring a child to use a different hand for a task is not the same as changing their underlying natural preference, because the left-handedness is a natural preference, is a concept of design. So you taking away the ball from their left hand and trying to put it in the right hand doesn't mean you succeeding in getting them to use the right hand to do a task. Doesn't mean that the underlying natural preference has been changed, has not been changed. And why that is dangerous is because it leads to confusion. And you see that later on as the child goes on. Confusion, things like cognition and some other things. Okay. The truth is that a young child sometimes change and mean something. No, not necessarily. Remember, not necessarily. It doesn't mean that something may not be wrong, but switching of hands does not automatically mean that something is wrong, because natural hand preference develops progressively. Some variations early on is normal, that I mentioned before. As they grow older, you begin to now see the preferred handedness. So left-handedness itself is not a developmental disorder, even though the same way it can be associated. Some people who have some developmental disorder may have handedness issue, or may even be left-handed. So you don't say because the child is left-handed, then that means there is a disorder. It's not a disorder. So even if a child has a disorder diagnosis, it should not be tied to the fact that it is because they are left-handed. So that's why some parents now believe that if I quickly not allow this left-handedness, that means that I will prevent any disorder. No. So even if a child ends up having a disorder and is left-handed, don't think it's because I didn't change the hand early. Oh, if I had done that, change the hand, this will not have developed. Most of the time, they are not coexisting. So if you have a child diagnosed with autism and is left-handed, don't think that it's the left hand, that because you didn't change the handedness, that's not what resulted in autism or any neurodevelopmental condition, like ADHD or cerebral palsy or anything. Don't associate it. They are not the same. However, there's something called mixed handedness sometimes that could occur, but it's not because you did not change the handing, whatever challenge with handedness or learning you've seen is because you didn't change that. No. Now let's talk about culture. In some cultures, the right hand may traditionally be preferred for things like greeting, for eating, for handing out objects, particularly even to the people that are older than you, or even religious practices. Some of these cultures, in this cultural context, deserve respectful conversation. We must clearly distinguish between social etiquette, that is culturally appropriate behavior in social settings, and natural hand preference. The hand the child uses for skill tasks like writing and drawing. A child can learn culturally appropriate behaviors without being forced to write or learn with their non-preferred hand. So we can respect culture without overriding development. So a child can teach a child, in this culture we use right hand, but it's not taking away their natural hand preference, which is the preferred hand for skilled task. Do you get it now? The fact that the child's preferred hand is the left hand doesn't mean that if in your culture you greet with your right hand, you can just teach the child as that. Teach. So don't take away their preference, and that's where empowerment and education comes in. And that's why you do it ahead, not when the child now becomes stigmatized, not when the child. So, however, the difference is now, if in your culture the child is now required to do a task that is a skilled task, like maybe lifting something, cooking something, then that's where the empowerment or the advocacy now comes in. You need to advocate for your child, because the left hand is the stronger hand for skilled tasks. So if he has to engage in skilled tasks in a cultural setting, you need to advocate for the child. All right. That is different from, I want to greet someone and maybe I have to stretch out my hand, or I want to hand over an object that doesn't require maybe the strength or the skill of the preferred hand. The child can be trained to use their right hand to do that in such settings. Okay, they can be trained to do that, to just know that that's what's done. So that's why I say we can respect culture without overriding development. All right. What does force switching look like? Sometimes it is obvious, like hitting or tapping the preferred hand, restraining one hand, holding the hand, punishing the child, forcing the pencil from the left hand into the right hand. But sometimes it's very subtle. Some labeling or words, side comment, things like use your correct hand. So like, use this hand. Don't use that one. Or give me your hand. What does give me your hand? Which one is the hand? The child has right and left hand. Or say, why do you keep using that hand? Or why do you keep doing that? Or we even use labels like lefty to make this is their lefty. If you don't call a right-handed person righty, I say it that why do you now need to call lefty? Saying that is labeling. And remember, it's not just about obvious things or that. there is an abuse or something. No, it's a subtle label. If you use your right hand and they don't call you righty, or you have another child that you don't call righty, why are you calling the left-handed child lefty? Intent matters, but impact matters too. So many adults who switch children genuinely believe they were helping. Our goal is not condemnation. Our goal is really education. Teaching is not the same as switching. Children absolutely need instruction in pencil control, handwriting, cutting things, tool use, fine motor skills. But teaching a skill is different from changing natural hand preference. So it's important that you respect, that is honor that preference in daily activities. It's important that you teach, instruct skills while using the preferred hand. Identify, that is, observe the child's natural preference and support. Provide ongoing practice and encouragement. And if you don't know what to do, you need to know where to go. So go to the right professionals who can help you, empower you, and also empower the child. Why should forced switching of hands be avoided? Using a non-preferred hand for skilled activities may make tasks more effortful or uncomfortable. Pressure around hand use may contribute to frustration, fatigue, avoidance, reduce writing efficiency, reduce confidence, negative feelings about learning. When correction involves punishment or humiliation or labeling or stigmatization, there may also be lasting emotional consequences. We don't need exaggerated claims to justify respecting a child's natural preference. Then also remember, I said before, what happens in childhood does not stay in childhood. Even if you succeed in changing the hand or you didn't succeed in changing the hand, the impact of the what do you call it, negative name calling, the pressure, the hitting and all that, it stays. It's like a scar. You may achieve the outcome, but what happens to the impact of all those experiences? So sometimes the biggest harm is the message. Imagine repeatedly hearing that wrong hand, bad hand, don't use that, don't do that. A young child may not understand the neuroscience of handedness, but they simply understand something about me is wrong. So we can teach without shaming, and we can guide without trying to override. So I talk about disclose, don't direct. A simple principle for protecting a child's natural hand preference is to disclose, don't direct. So tell the adults around the child what you know about the natural hand preference. That's why it talks about every time a child is in care of an adult, and it is that adult's responsibility. So as a parent or a caregiver, always tell the adults around your child. So for example, you take your child to school, sports center, music center, tutorial centers, childminders, church, Sunday school, holiday programs, even family, extended family, and friends, social settings. Disclose about the child's natural hand preference. Even if the child is still young and they are still emerging, still always disclose, still mention it. Don't direct. So don't influence a developing preference towards either side. Let nature lead. Let God's natural design lead. And this applies to all environments. Every environment that puts tools in your child's hands matters a lot. If the child is already left-handed, tell the adults around them. A simple statement may be enough. My child has a natural preference for the left hand. Please allow them to use their preferred hand for writing and other skilled activities. Whether it's sports, whether it's writing, whether it's painting, engaging, cooking, anything that they're going to engage in activities. Don't wait until a problem occurs. Early communication helps to prevent misunderstanding. And for a child who is knowledgeable already, inform them. In fact, there's an interesting concept that I also come up with. I will share that after this. So inform before you need to complain. Inform before you need to. So when you're taking a child to a school, you need to inform them. Even if it's in the early years, inform them. Then communicate clearly and early and ask questions. Are they familiar with such things? Have you handled it before? What is their policy around it? Follow up to make sure it's being respected. So, and if your child is older, always follow up with your child, and remember, have that line of communication and tell your child from time to time, reinforce it and ask again, so that if anything is happening, your child can flag it. There are also other interesting things I think you can also do. For example, if it's a social setting or sport, you can simply make a shirt. You can see my shirt. I have on my shirt, please don't change my hand. So you can put it on the child, proudly left-handed or something like that, such that the child is entering an environment everybody already knows, and you're already coming from a place of empowerment. And as your child grows older, begin to educate them about this and empower them, tell them the neuroscience, tell them that it's God's unique design, make them understand that it's special. So if anybody wants to put them down, they educate the person. See, people can put you down if you don't know yourself. So before the attack comes, you're empowered in knowledge. In fact, in your child's school, your child can do presentations about it when they are older. They are supposed to do a project. The class can do a project, bring facts, bring education, bring awareness, advocacy, empowerment. If preference is still developing, say so too, like I said. Her hand preference is still developing, is still emerging. Please allow her to choose naturally and avoid directing towards either hand. A child whose preference is still emerging should not be pushed towards the right or encouraged towards the left simply because adults want to protect left-handedness. So don't choose for the child. Let the child's natural preference develop. Then ask, don't only tell. Parents can move from providing information to building partnership with their child's school educators, and every setting that I mentioned that your child has to be in, whether extracurricular, whether religious setting, church or anything. So ask questions like, how do you support left-handed children? Are your staff familiar with teaching left-handed children? Will you contact me before changing or directing how my child uses their hands? Particularly, they're going to engage in tools. And if your child is having any difficulty, they should contact you. So advocacy does not always begin with confrontation. It begins with conversation and proper communication. So protecting the hand is only the beginning. You advocate for your daughter. The school agrees she can use her left hand. But months later, she still writes slowly. She smudges her work. She hooks her wrist, complains of discomfort, and she's struggling to see what she has written. Someone may conclude, oh, maybe the left hand really was the problem. However, what if nobody ever taught her how to write comfortably as a left-hander? So allowing the hand is not the same as supporting the child. Very important. So that's why those questions, asking the educators or the settings that, are you familiar with this? Do you have knowledge? How do you have knowledge of supporting? That conversation will let you know where someone stands, how they respond. They probably can give you examples of other children they've worked with. They can give you examples of trainings that they've undergone as the facility organization or an institution or a school. Okay, so left-handed children may need different support. So simply allowing the left hand is not always enough. A child may benefit from appropriate guidance around paper and desk support. So correct paper angle and desk arrangement for comfort and visibility. So there's a way, there's a desk setting, paper arrangement, wrist and grip positioning. All right, so comfortable pencil grip without excessive hooking. Tool settings. So for example, things like scissors, we have left-handed scissors different. All right, even things like instruments like guitar, there's left-handed guitar, suitable seating and appropriate lighting. Don't change the child to fit the environment, rather adapt the environment to suit the child. Okay, so a quick writing demonstration. 3 things to observe. Paper position. Is the paper position so that the child can write comfortably and see their work? Wrist and hand positioning. Is the wrist relatively comfortable for the child? The grip, can the child hold and control the pencil without excessive tension or blocking their view? So you know that if you're writing with your right hand, you do like this. With the left hand, the positioning is different. So you cannot put the paper the same way you put for the left hand. So that's why it must be comfortable. The chair and the sitting arrangement as well. So the goal is comfort, visibility, control. What I mean control, the grip of the pencil and the paper, and efficiency. This is not perfect posture for every left-handed child. The detailed practical teaching will be in our resource pack in implementation masterclass. I'll talk about that later. So support at home as well. Parents can make profound difference through simple, consistent actions like allowing a natural hand preference to emerge, avoid repeatedly transferring objects to the right hand, observe rather than control. Then communicate with the school owners, caregivers, and other adults in different settings you're going to put your child or your child will find themselves. Communicate ahead as you're taking your child there. Teach relatives about your child's preference. Also, you as a parent get educated, and that's why this master class is about, and that's what the My Left Hand Champion initiative is going to be doing going forward, to be educating and empowering parents. Because when it's not enough to complain, knowledge. And remember, it's about partnering with your child's school educators and all these settings, not confronting or fighting them. Avoid negative language around left-handedness. Help the child develop confidence in their natural preference. Don't make left-handedness just the child's problem. I talk about supporting school. Educators can create an inclusive environment by respecting established hand preference allowing adequate writing space, considering sitting arrangements, teaching appropriate writing techniques, avoiding comparison with right-handed techniques, communicating consent with parents early, seeking occupational therapy and other professionals' input when genuine motor difficulties exist. So inclusion sometimes begin with something as simple as where we put the pencil. So you need to consider that. So when it may be more than handedness, yes, remember I said this, even though handedness, left-handedness is not a disorder, it's not, but hand use can sometimes provide important information about motor or neurological development. So you consider further assessment when any of the following exists. There's sudden change in preferred hand without influence, or there's clear weakness or asymmetry on one side, loss of previously acquired skills, significant fine motor difficulties, pain or restricted movement, other developmental concerns. Don't pathologize natural difference. So that means what it means is that a natural difference, don't say it's a pathology. Pathology means that disease state. Don't say there's something wrong. But at the same time, don't ignore genuine developmental concerns, because these are developmental concerns. If the child's writing, the handwriting, there's pain, there's weakness, and you see that weakness show up in other things, the way they are throwing the ball, the way they are cutting scissors, other things, or sudden changes. It's important to flag it, discuss with your, if in the school setting, discuss with your proprietor or whoever you report to, then discuss with the parents, then the appropriate professionals will be engaged. So left-handedness does not equal to motor impairment. Left hand plus developing, for the child developing typically, handedness alone does not indicate a developmental problem. Right hand plus experiencing motor difficulties. Difficulties can occur regardless of which hand a child prefers. So the important questions are, is the child functioning comfortably? Are skills progressing, developing progressively? Is there weakness or asymmetry like unevenness or significant struggle or weakness? Are there other developmental concerns with other milestones for the child? Fine motor, with recognition, which is understanding, speech, communication, understanding, following instructions, problem solving. Those are all other developmental milestones. Are there challenges in those areas? So remember, assess the child, not the label. In medicine, there's something we say, we treat the child, not the lab results. It's an interesting thing we say in medicine. So for example, you go and do a blood test or something, and the result comes out and it's like saying not something is not there, but symptomatically or what you're saying, the person shows all the symptoms. So we say we treat the person, not the result. So the same thing I'm saying here, assess the child, not the label. Not just say because the child is left-handed, then this is normal for that or things like that. So they always focus on the child. So tell the child that's where empowerment, part of empowering the child. Parents often tell the teachers, the grandparents, the coach, but forget to tell the most important person, the child. A child who doesn't understand handedness may simply comply when an adult moves the pencil. But a child who understands that it has something, that it has something very valuable, language. Adult advocacy protects children, but children's knowledge begins to equip them as well. All right. Give them the word. So that's why you must get the right knowledge. So they are passing the right knowledge to them. So that if you pass the right knowledge, it's not about fighting, it's not about, no. Empowerment means you pass the right knowledge, help them to know themselves, help them to advocate, then help them to escalate to you or the trusted adults around them. Because like I said, sometimes the parent may not be in the setting. But every time your child is in care of an adult, and every child a parent is absent, there must be a trusted adult. So never put your children in systems where you have not considered a trusted adult, because that's why a child must always be in the care of an adult, and a child must always be safe with any adult or in every environment. That is like duty of care. So as an adult, all children in your care, whether they're your children or not, you have a responsibility to ensure that they are safe. And you have a responsibility to have the right knowledge. Because if you don't have the right knowledge and you were raised with certain myths, you may be propagating or replicating something with good intentions, really. But that you mean well doesn't mean you won't have negative impact if you do the wrong thing. Okay, so ignorance is not an excuse. So teach children simple and respectful language. So empowering them doesn't mean that they are going to be rude or say anything. So it's from a place of knowledge, also from a place of empathy. And because sometimes you empathize with people's ignorance, really. Someone trying to bully your label, you'll be like, oh my God, they are ignorant. So educate their ignorance. And it makes you empowered and not makes you feel less. Because once you know yourself, nobody can put you down. Because let your children know themselves before somebody starts telling them who they are not. So the first time you are discussing handedness with your child, it's not when somebody starts shaming them in school and laughing at them and they are crying, mommy, they said this, or daddy, they said that. And you're not like, no, it's actually no. See, there's what we call the law of first mention. The first place you hear something, or the first narrative about something that you hear, it stays with you. It's just like when there is a case, someone does something to you, the first person to report always has an upper hand. Why? Because the first person that mentions something or reports something sets the tone. The other person coming is like, you're coming to come and defend. So even if you were right, you have created a wrong perspective, or you have put yourself on the negative from the beginning. But which is the same thing, empowering your child and letting them know about this first, so that when someone is mentioning, whether it's a teacher, educator, or an adult, or a child, likewise, the child is empowered, and much more they can escalate to you, and you can take it up from there. So give them, respectful language, like, I have a natural left hand preference. I write with my left hand. This hand works better for me. Please leave my pencil in this hand. Please don't change my hand. Which is that's our webinar today. There's something that same thing, that my left hand is my dominant hand for writing and doing other skilled tasks. So this is not about teaching children to be confrontational. It's about body awareness, confidence, communication, and self-advocacy. So yeah, I mentioned that here. Change the language around the child. So avoid things like, oh, she's left-handed, oh, you're left-handed. Oh, he's a lefty, he's our lefty, or the lefty in my house, or calling each lefty. That's your bad hand. Or why can't you just use your hand? Instead, begin to use words like, oh, she has a natural left-hand preference. You don't have to apologize for it. No apology, no shame, no deficit language. She has a natural left-hand preference. So it's a preference, left-hand preference that came by design, by how God designed them. Okay, then give the child what every child deserves: good teaching, like I mentioned, appropriate support, confidence in who they are, and let there be open communication that they can escalate things to you. So it's important that we move from awareness to empowerment. Like I said, it's not enough to identify and highlight that people are forcing children to change their hand. No, so at the My Left Hand Champion Initiative, we have 4 pillars. And the 4 pillars of the My Left Hand Champion Initiative are awareness, which means to understand. And that means we recognize handedness as natural human variation. So that understanding, the handedness is a natural human variation, very important. We are creating that awareness so that people can understand this. Then advocacy means protect the child's natural preference. So you need to respect that design, and we need to protect it. Number 3 is education. Like I said, knowledge is very important. Know what the child needs to learn to thrive. So, like, it's not enough to just know, okay, it's a natural preference. How are they going to, like I mentioned about the simple example of writing I talked about, you need education to provide the right support. Because if you don't have the right education, for example, I said we have things like the left-handed scissors. So if you don't have that education, how does an educator, a school environment, support such a child when all the scissors, all the tools that they have in place for those children are catered or targeted or tailored to right-handed children? You as a parent, so how will you go and advocate when you're engaging the school? If a school tells you, oh, we know we do, and you ask them what are the resources, they can show you. Oh, we have a left-handed scissors. In the sitting arrangement, this is how a teacher will structure the writing paper. So know what the child needs to thrive. Okay, then empowerment. I talked about empowerment. Give the child knowledge, confidence, and a voice. Also, empowerment for schools, for educators, and for health professionals, which is why the initiative is here. We're going to be doing trainings, we're going to be providing resources. So we want you to understand, we want you to respect, we want you to support, and we want you to empower. Okay, as we create awareness, advocacy, education, and empowerment. So your 5 take-home actions, I want you to observe. So if you have any child around you, if you have a younger child, begin to observe, notice the child's natural preference. natural patterns across different activities. So regardless of the age, if you have a younger child, like a baby, that they start moving their body, begin to notice their preference. You will begin to sometimes, like I said, it's not all the time you may be able to know. It's not all the time that it may be profound, but in some children, it will be profound. The profound difference, how there's a stronger hand for pulling their rattle, pulling things, grabbing their bottle. But remember, I mentioned for younger children, they may still use both. But as they grow older, towards like 4 years old, that's when you see the distinction. The most important thing is not to influence. So just don't just hand over things to them. Put things and let them be the one to reach out. Just stay back and what you want the reach for. Okay, because also know that if everybody around the child is right-handed, so because children are studying around, it's so easy for the child to want to be having that confusion. But just always encourage them to reach out. See when they are alone trying to reach things and just playing on their own, you see. Then don't switch. So avoid directing an established preference towards either hand. Then disclose, tell all relevant adults in your child's life and all settings, including family, friends, religious centers, extracurricular music tutorial, school, any environment. Disclose, tell all relevant adults, introduce your child to them and ask questions, like I mentioned. Then support, adapt the environment so that it works for the child. Both the home environment, and if you're going to another environment, ask them questions and ask how their environment, because that's also part of inclusion. So inclusion is not just tolerating a child, it's about adapting the environment to make sure that it is well equipped for the child to also thrive and learn. Empower, teach the child about their own handedness and give them the words, and also empower the people around you. So if somebody uses a stigma or whatever label, just because they're ignorant. So don't come from confrontation or fighting. Extend grace to them and rather come from a place of knowledge and share that with them. In fact, you can even have resources we have a resource pack we're going to be sharing. You can have some resources that can be printed. You can download things and show them, get them to read, send them some of those links. You can even send them this free masterclass and they can learn. So small changes by adults can completely change a child's experience. So understanding is only the beginning, I said. So today we have explored why natural handedness matters. But parents and professionals often leave with another question. What exactly do I do? What do I tell the school? How do I observe preference properly? How do I teach my child to advocate? I've mentioned teach your child to advocate. I've mentioned how to observe preference properly. How should the writing environment be set up? What do I tell the school, or what do I tell the children's church? What do I tell, enrolling my child for extracurricular? What do I tell them? Sports and things like that. What do I tell them? And that's exactly why we created the My Left Hand Champion resource pack. So we have a resource pack that has been created. It's called the My Left Hand Champion resource pack. And the goal is to move you from understanding to implementation. So it is designed for parents, caregivers, educators, health professionals. A practical collection of tools designed for parents, educators, health professionals. It will include a parent guide there. So some of the things I said, adapting the home, having a conversation with your child will be there. Hand preference observation tool. How do you begin to observe based on the age of the child and both chronological and developmental age? School teacher handouts, how to support educators, and how to create the right environment, how to support these children even in the school setting, how to create policies and advocate for these children as well, and to encourage inclusion. Disclosure and advocacy toolkits. Remember, you disclose. You don't have to confront. You don't have to force. And things like that. Then you don't have to direct. You're disclosing. All right, and advocate for the child. Left-handed writing support guide will be there. Child empowerment resources, I mentioned, very important. As the children grow older, you empower them to know themselves and be able to advocate for themselves and escalate when necessary. Professional and educator brief, that will be for educators as well and for professionals. And practical checklists and scripts, things like scripts that you can, when you want to talk about your child to the school or to any setting, what are the scripts you can use when you're even talking to your child as well. Because most of the time, when you're empowering children, don't just say, stand up for yourself. Parents say things like, the child doesn't know what it means to stand up for themselves. When you're teaching children how to advocate for themselves, how to speak, you give them scripts. You give example. If somebody says this is how you respond, and this is why. Because, of course, you're coming from a place of having taught them and told them about themselves. So when you give them scripts, they are able to now advocate for themselves and they're empowered, appropriately. Not just information, tools that you can actually use. So the resource pack is going to be available. It's going to be on on the pre-order basis. And the reason is because anyone who purchases this anybody who purchases this for people that attended this masterclass and are going to purchase the resource pack, there's going to be a bonus masterclass, and that's going to be at the end of this month, because we're giving so that we're giving enough time, at least have enough time to be able to partake of this flash sale. So this flash sale is for people who have attended this webinar, people that attended this masterclass, because this price is going to increase by what's today is Saturday 15. By the 18th, this price is going to go up. It's going to go up, and the bonus of the masterclass will be taken out. So people that are going to purchase after 48 hours, this bonus will not be there anymore, and that it's going to go back to the original price, and the masterclass is not going to be included. So for people that are attending this free masterclass, this is the flash sale price, and we're giving the free masterclass. So it's going to be a free like implementation masterclass where all the resources that are going to be inside, a lot of resources. I didn't even highlight everything. There are going to be lots and lot of resources that are going to be there. All right. So expert guides to understand and support, practical tools, printables, resources, things that you can share even with your children's school or any setting, scripts you can use across all those settings. So I said like the special masterclass price, that's for these people that attended this masterclass. These are all the things that are inside. So implementation masterclass will be today we are just have helped you to understand what it is, but this implementation masterclass will help you to be able to put it into practice. That's what I'm going to be sharing at that masterclass for people who purchase the resource pack. It's only for people that purchase within 48 hours. After that, we close it. So we want to hear your story. Really, I know a lot of us have lots of stories to share. I know we have a lot and what do you call it, can help a lot of people. Were you ever made to change your hand? I would like to know. Were you ever made to change your hand? Perhaps you remember being corrected. You remember having your hand tapped. I remember those days you have people where you would take a ruler and smack your hand, or take a stick and hit your hand. Do you remember being told the left hand was wrong, or learning simply to comply? You have to learn to comply. Or perhaps you had a champion, maybe a parent who protected you, a teacher who understands you, someone who told you there's nothing wrong with you. I would like to really hear your story. So we want those stories. So we want you to share your experiences with us at the My Left Hand Champion. This initiative, that is what it's about. All stories matter. So the difficult stories, and we'd like to hear it. In fact, if you still have trauma from those kind of things, we can direct you where you can get help. I know that what happens in childhood doesn't stay in childhood. Maybe people are looking at you and think that, oh, you overcame me, finally you're using your right hand and everything is okay. But you deep down still live with the stigma, the scars, and the trauma and the uncertainties from those experiences. Your story matters, your voice matters. We want to hear the stories, the difficult ones, or not all cases are difficult ones, like the supportive ones. You had an adult who advocated for you, or a parent who advocated for you, someone who understood, or you never had there was never any need to feel different, because probably you were just supported with, all your life, all the environments never saw anything wrong with you. Your story can help another child. Your story can help another family, another educator, another school, or you a school owner who you have left-handed children, and maybe you struggle to help them, or even have challenge, or you have maybe even pushback from parents, or even from some educators. Some educators may not know, may still be following the myth of belief. And are you a school owner who has also been thinking, I want to get my educators trained, I want to get people in my school trained, or you even work with children church, all those things, you want to get your educators trained, or you want to even get the parents trained, because some schools will be having challenges with parents, because parents are still holding on to the negative beliefs, or you belong to the parent teacher association in your school, and you think it's a conversation you want us to bring. Let us know. Remember, your story is safe. Stories will never be publicly shared without permission. Your voice is your choice. So remember, we're speaking on the that please don't change mine. So share your story with us. You can send us an email, autismrenew@gmail.com. You can visit our website, www.autismrenew.com. Follow us on Facebook. You can connect with us on Instagram. Send us a DM. Okay, share your story with us today. Your story can raise awareness. Your story can challenge misconceptions and narrative. And your story can encourage another left-handed child, or even an adult, or even a parent, or a school or an educator. So your story can help another. Just remember. So stories shared with us will never be publicly used without permission. So your experience can help educate families, equip educators, and show what supportive adults can do differently. And if you're also a medical professional out there, please, you can reach out with us. Or if you have an organization who is already championing this movement as well, we would love to partner with you. So please, you can reach out to us on all these platforms, and we will be happy to reach out, to partner with you on this amazing project and on this journey. So, some common area of questions. I'm gonna share some common questions. My child preference is not clear. What should you do? My child was already switched. What next? What if the school insists? How do we navigate cultural expectations? Is less than next to autism or ADHD or dyslexia? I've answered most of these questions. When should I seek professional assessment? All these are already answered. I've answered all these questions and more will be in the resource pack and the masterclass. So a champion doesn't have to be an expert. A champion might simply be, I want you to be the champion. So you don't have to be an expert, really. You can just be a parent who says, please allow my child to use her preferred hand or his preferred, or the hand he or she naturally prefers. You are a champion can be the teacher who notices he works better with his left hand, or you're a coach, a soccer coach, a tennis coach who is noticing. You can also be the professional who reassures. Left-handedness itself is not something we need to treat, something we need to understand, because the concept of design and difference is not concept of being less or being deficient. A champion can be the child who finally knows enough to say, this is the hand I use, and know how to advocate for themselves. So in conclusion, we began with these words spoken for the children. Please don't change my hand. That's what we began with. And the whole of this webinar has been to help us to understand and to support the left-handed child. So we started with the child's voice. Please don't change my hand. Our goal is to reach a point where children understand themselves well enough to speak them to say, please don't change my hand. So I want us to understand them, to respect their natural preference, to support them to develop the skills they need, and to empower them with the knowledge and influence. And if you're an adult out there, you're still dealing with the confusion, the struggles, the cognitive delay, the understanding, the writing, and because you're an adult, it's difficult for you to share. Please reach out to us. We would like to hear from you. Okay, remember, reach out to us through our channels. We would love to hear from you. You can reach out to us, share your story with us. And I want to share a story in closing. One of the things, like I said, this initiative is from the Autism Renewed. Being a special needs expert, I've been working with children and parents and families when it comes to learning difficulties and supporting children to learn. And along the line, one of the learning differences that I discovered that could cause learning difficulty is switching handedness. However, I had a personal experience with this, and I would like to share that is quite profound. I have a personal experience when it comes to this, and I want to share that story because it further reinforced what I was seeing in my practice. Okay, one of my children has a left hand preference. Of course, because I'm a professional and I'm an expert in this. By the time the child was born, it was easy for me to already spot it. My husband and I were able to spot it from the beginning that the child was born, that preference, even as a baby before 1 year. We could see because we were knowledgeable already on it. Okay. So, but like I mentioned before, when children are still younger, they could use either hand. So we're not trying to influence anything. We just allowed natural development. However, when the child got to a particular age, I think that was around maybe 3 or so, and the child started was showing interest in sports. I also wanted to expose our children to different form of sports, and we noticed that one of the sports that the child liked to do was anything that had to do with the hand. I mean, maybe things like using a baton, so things like cricket, things like what do you call it? Is it baseball, tennis, or in any sport that you swing your hand? The child had a preference for such sports. So that's okay. Let's try out. There was a tennis club who was doing tennis club for kids. So it's okay, let's just try out this sport. And the child started saying, okay, I think I would like to try tennis because we bought some tennis balls and some rackets. We're always doing it. Or I want to try out like a real training. It's okay. We say, okay, let's go there. So on the day of the tryout, what they do is that they have tryout sessions for children. So where the tennis coach would stay with the child and try out with the child and test in the child's skill ability and know where in the training to put the child, or whether the child is even old enough or fit enough, whether anything, they will give you that feedback. So we went for the tryout. So what happens is that the parents will be there, you step aside, you leave the child on the tennis tennis court with the coach, or even though you are there, you are just right there, you can see. So when we did that, we stepped back and the child was there and handed the racket, and the coach was on the other side, and we noticed that the coach was swinging the ball, the child froze. Very unusual where we were. I was on another side of the court, my husband was on another side. So we're looking at each other like, this is a child that is always excited and told, doing this. So the child froze, held the racket and froze, like literally froze. So we're wondering what's going on. And what's going on? What's happening with this child? So we're wondering what could be wrong and things like that. And all of a sudden, I just remembered that because my husband was the one that took the child there. And so I now just whispered to my husband that, did you remember to tell the tennis coach about, at this stage, the child has a preference for left hand? Remember, I said we don't influence, but we give that information anywhere we put our children. Do you understand? So we just leave that information so that we tell the person not to influence anything. That's the goal of the what do you call it? Of telling them. All right. And he just remember, I said, no, I didn't. So he just went to whisper to the soccer coach and say, excuse me, this child has a preference for what do you call it? For their left hand. The coach was like, oh, I was wondering. Then the coach went ahead, took the baton from the child's left hand and placed it in the child's right hand. Immediately, it was like the child came alive. Where I was a bit disappointed. My husband and I, we looked at ourselves like, what? And because I'm the professional, it's something I've been sharing with him, but of course, he understood. But being someone that is not medically inclined, that was like, it was like a light. My husband was like, what? Both of us were like, what? The child literally, and I know kid you, came alive, like boom, and started responding and started hitting the ball and responding. I was like, wow. I can't forget that thing. I can't. And that further strengthened my resolve regarding this thing. It strengthened my resolve when regarding what do you call it? Regarding this thing, regarding handedness. Because it wasn't, I'd been seeing it, but it just buttressed the point of the impact that what do you call it? The impact that handedness could cause to a child. So I was like, imagine that the child was in a school and they were trying to force the child to write, to read, and you notice that the child is just freezing. The child is freezing, the child is not saying anything, and things like that. They'll be wondering, maybe the child is done learning and things like that. And I imagine that you're a parent who, you did not go to find out questions. You didn't create a system where you are going to advocate for your child and things like that. So they'll come and say, oh, the child is struggling to learn. Sometimes before you will know it, some parents are just hitting the child. They are shouting, not knowing where it came from. You see how it can trickle. So for me, it further strengthened my resolve to be able to empower parents. That's where knowledge comes in. Because if I didn't have that knowledge, I'm probably wondering, maybe the child is not interested in the tennis again. Maybe the child doesn't want to be here again. Or why did you say we should come? Let's be going, or things like that. And so I wanted to just share that story so that we understand the impact of what do you call it, handedness. And remember the flash sale again for the My Left Hand Champion Resource Pack. So this pack, we're going to be sharing it, and the free masterclass bonus. Anyone who purchases in the next 48 hours gets the free masterclass bonus and gets to buy at the flash sale price. Okay, so the link, so if you're interested, for those that register for this masterclass, you get the link in the what do you call it? The link is in the comments section. You see the link in the comment section. You can register for the what do you call it? You can click on the link and register for the and get to register to purchase this. Okay, to purchase the resource pack. All right, register to purchase the resource pack. So you get the link. The link will be posted in the comment section, and you can register to get the masterclass. Thank you everyone for joining once again. Thank you for having me. If you have other questions, does anyone have any question? If you have other questions, you can put your questions in the comment section. Let me see. If you have any questions, put your question in the comment section. We just have 5 minutes or less than 5 minutes for comment section before we end the live stream. So if you have a question, you can put your question in the comment section while I share that on the what do you call it, on the resource pack again. So remember, share your story with us. If you have a story, would love to hear your story, would love to hear from you, and do well to purchase the resource pack. And alrighty, so those of us that are in the community, you can drop your questions and we'll be happy to answer them. So thank you everyone for joining me today. I'll see you all next time. So remember also to follow us at Autism Renewed on Instagram. Our website is www.autismrenewed.com, and send us an email at autismrenewed@gmail.com. You can share your stories with us. We would love to hear them. You can tag us as well if you're an organization that you're championing this movement, or you know any organization that is championing this movement. Please let us know. We would love to hear from you. Thank you, everyone. I'll see you next time. Bye for now.